Good morning, happy holidays. Dr. Eric Leginski here at Fanwood Back Relief Center. Today we're going to talk about some exercises or stretches for wrist pain. Typically when somebody injures their wrist, it's one of a few things. Tendinitis, which is a strain of the actual tendon or muscle. Ligamentous injuries are considered sprains. Carpal tunnel syndrome is another injury that we see commonly in our office. These three injuries, the tendinitis, the ligamentous injuries, and the carpal tunnel syndrome, are usually a result of just overdoing, overuse, repetitive motions. So it's very important that if you are doing something, whether it's playing guitar, typing, cutting hair as a hairstylist, that you do take breaks throughout the day. It doesn't take much. You could just take a break for 30 seconds, maybe do a few stretches, and then get back into your job or activity. It does make a big difference. It's the prolonged repetitive stress that usually causes inflammation to the tendons, which can irritate the nerves, can make the tendons and the ligaments very sore and uncomfortable. But today we're going to go over some simple stretches and exercises that you can do on your break, which will help immensely. The first one we're going to go over is it's basically a handshake. So what you're going to basically do is just shake out your hands like this. You want to spread open your fingers and you want to just shake them out. You can do it palms up, palms down. Okay, you want to just get some mobility in the wrist and fingers. The second thing we're going to do is we're going to make O's with our fingers. So we're going to go thumb to pinky, thumb to finger, thumb to finger, thumb to finger, and we can go back and forth like this. Want to get that fine motor skills in there, get a stretch in each one of those digits. Same thing on both sides. Obviously, we're doing both hands each time. The next thing we're going to do is we're going to do what's called a fist fan. So what we're going to do is we're going to clench a fist, and then we're going to slowly open and fan out those fingers, okay, and stretch them. Okay, fist, fan. Okay, very simple. The next thing we're going to do is some wrist bends. Now, there's two ways you can do this. You can do it with your palm up or palm down. So we're going to start with our palm down, and we're going to come straight down, bend only at the wrist. We're going to hold for a few seconds, and then we're going to come straight up towards the ceiling, hold for a second or two. You might hear some popping, snapping. That's okay. That's just the tendon stretching. And we're going to do this nice and slow and controlled. Okay, and then we can reverse and we can go palm up, palm down. Okay. The next thing is we're going to stretch our fingers, our tendons from our fingers all the way down to our forearm. And the way we're going to do that is we're going to bend our wrist, our elbow 90 degrees. It's helpful to do it on a table or on a chair or something, countertop. And then what we're going to do is we're going to take each finger and we're going to slowly stretch. Get a good traction of those tendons. Just like this. Okay, we're going to go through each one, stretching those tendons really good. Good. All right. Next up is we're going to do some wrist resistance. So making a fist, what we're going to do is similar to the wrist bends, but what we're going to do is we're going to put a little bit of pressure against it as we pull it. Okay? Good. Pushing against the hand. This is more of a strengthening thing. We're going to do this again, always on both sides. Last one is a ball squeeze, or if you don't have a ball at home, what you can do is you can take a pair of ankle socks, make a ball out of them, and you're just going to put them in your hand. You're going to squeeze them nice and tight, and then release. Squeeze them nice and tight, and release. Now, these are just some of the exercises. Obviously, it doesn't have to be really exact. I mean, you can stretch from left to right, up to down. You can do mini circles. The key is you want to mobilize. You want to mobilize the joint. You want to make sure there's a good exchange of oxygenated blood through the joint. You want to stretch those tendons that have been overused, and you want to take the time to rest them. Of course, if it's really painful, you could always apply ice to the area. Topical creams like BioFreeze and Cryoderm also work well. Give some warmth to the tissue there, and it helps make it feel better. Hopefully these stretches and exercises are helpful for your wrist pain. If they are not helping. Obviously, there's a lot more we can do in the office. Everything from mobilization to manipulation, adjustments of the wrist and the hand and the elbow. Also, deep tissue laser, class 4 laser is also helpful, decreasing the inflammation. So those are just some of the things that we do in the office to help patients when they're experiencing wrist pain or carpal tunnel syndrome. If you like the video, please click like, share it. If you have any questions, like I said, shoot us a message, give us a call. We're always here and happy to help. And hopefully you're enjoying the weather this week. It's a nice weather week. Talk to you soon.